CEO Live Talks.
I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change, and these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon, and welcome to CEO Live Talks. I'm your host, Dr. Swannie Jett, and welcome to episode 2 with Ms. Flanery. You have totally flipped the script, and you went from the legal side of things now to numbers. Right? How did you make that transition? Because a lot of people, they can't do that either. And you're English background. Right?
Yeah.
But you have totally used people that like English. They don't go to math.
Right.
Or they don't go to finance.
Right.
So how did you do that?
Because I'm really the words part of math,
Okay.
I will say. So I would not be somebody that would be good to be the numbers cruncher
Right.
that was advising other people. But I understand financial concepts. But part of that is because I was a lawyer.
Right.
And so I do think that it's easier to traverse that at a certain level.
Right.
If you're over, I've been on a lot of audit committees, I've dealt with a lot of accountants, CFOs,
So you
I've
can
been in
tell
the
that
same
story.
room with them.
Right.
So I know things that are important. And then from the legal perspective, I would have to sign off on them as general counsel, right?
Right.
So I think it's the framework, it's the overarching framework more than being like the numbers cruncher or the quant, right? Or the quantitative person that would be advising. Because I'd go to Wall Street with the people who were in the Office of Financial Management,
Right.
when I became finance secretary,
Right.
And that's how I left state government. And I hope, I got the impression and the belief that the people who reported to me did believe that I understood the framework of what needed to happen.
Well, if they explained it well, because it's all in the briefing.
But they were wonderful.
Yeah.
They were absolutely consummate professionals.
Right.
And I would hire, I'm not in a position to do that now, but I would hire literally any one of them all over again.
Okay.
Yeah.
That's a good thing. So, one thing you pointed out, and I did notice, so I took note. Most of the time, people came and offered you positions, or they came and asked. So one thing that people need to understand is when you do excellent work, people will come and ask. You don't have to apply.
Thank you.
So that's a testament to the work that you have done.
Thank you.
So now, did you get the job?
So I in economic development through my finance role because I had been there, so that's the work they gave me to do as deputy, and it happened to be the anniversary of the 6-month date, but I wasn't thinking that. And Jonathan asked me to drive him somewhere, which he never did.
Right.
I was like, okay, I could be doing something else, but yeah, I'll be happy to.
Right.
Well, it's because he was wanting to talk to me about this. And he said, I need to know, because I will help you if you want to go back to Kentucky Housing Corporation. I need to know, but will you stay here? And I said, I can't leave. It's just too interesting here. And I still get to deal with Kentucky Housing Corporation.
Right.
Because finance is on the board.
Right.
So it really opened, sometimes I feel like you have to have your world open up for you. Right? I would have gone back to KHC, been happy as a clam. But I'm doing different things now than I ever would have done if I hadn't gone to finance.
Right.
And if I hadn't gone to New Directions.
Okay.
Yeah. So
I'm assuming this sort of set you up to come to New Directions. How did that
No.
Okay.
So I knew my job was going to end in state government, right? I was not going to be able to go back to another cabinet that I'd been in because of where I ended up.
Right.
And so I knew that my last day was going to be in December of 2015. I decided, I had a couple of offers, but I needed a break. I was going to take a break. And so in February of 2016, New Directions was doing a search. Joe Gleasner, who was my predecessor, was there for 30 years, and he was amazing. I knew him from my work in state government.
Okay.
Just a stellar reputation. But he was going to be leaving at the end of June, 30 years, going to be gone. And so I was asked, would you consider, being in the mix, not just, take the job. would you be interested in this? And I said no. And the reason I said no is because I thought I might be going backwards.
Okay.
I thought I might be going backwards into just housing.
Right.
And that it was a nonprofit. I'd never run a nonprofit. And that it was smaller. And I didn't think, and also I had the statewide. And so this was hyper local, right?
Right.
And so I said no and really didn't think about it again. But I was going to Jewish Family and Career Services had been recommended to me. There was a guy there named Bob Teal. Unfortunately, he is retired because he's a legend.
Okay.
And I never heard of him because I wasn't really in the workforce development world.
Right.
But he's known really regionally for helping people with mid-career decisions. And I was trying to figure out what to do. So I went to him. I kind of thought it was like a vanity exercise. I didn't tell anybody about it, right? But I spent from February to July, every once in a while, once or twice a week, going and taking all of these tests. And he really helped me figure out what I might want to do next. Gave me a list of like 10, usual suspects. Mm-hmm. And one of them was being a lawyer, right? Mm-hmm. One of them was running a nonprofit. I didn't even think of that. And the same week that he went through my final stuff, I got a call again from New Directions. They had done a search, and the person was from DC, and he decided not to move. He just thought it was too big of a move to Louisville. He's like, really sorry. I cannot do it.
Right.
Can't leave my family. So it opened up again, and they said, would you be interested in talking to us? And I said, I'm not really interested. However, I had accepted a position that started July 1 to be on the board of the organization that is most like New Directions in Louisville. It's called HPI, or the Housing Partnership.
Right.
I had agreed to start that board, and I thought that would be my housing fix, right? Okay. I'll be on that board. And I said, I don't think I'm the right person for that. And they said, well, you come in and talk to us because we've decided that we really want to focus on somebody local. And I said, sure. And, one thing led to the other. And I realized I was, again, not thinking broad enough about this organization. Yes, it's about affordable housing. Yes, it's hyper-local. Mm-hmm. But it deals with workforce issues, transportation issues, education issues, childcare issues, financial issues, everything on top of that floor of affordable housing, which is still critically important. I care a lot about, a lot. You could focus only on affordable housing and you would be doing something good. But this had everything.
So I'm curious, because you did something I think I would say maybe half Americans do. You sat down with somebody and they did an assessment.
Yeah.
And that's, like I said, most people don't do that.
Right.
Right. But what spurred you to do that in your mind?
I was hearing from my friends, this guy's a legend. This guy helped so-and-so.
Okay.
This guy, and these are people who were very well connected.
Right.
And I thought, well, if they're willing to go to someone who is doing this, then that must be worth something.
Right.
Right? Because I did not know this guy from anything. I'd never been inside Jewish Family and Career Services. But it was, now that I know about it, and now that I'm not embarrassed that I was doing it, and then I think it worked for me, I tell anybody, Bob's not there anymore, but I'm assuming, right, all of the same partners are there, yes, and they're still helping people.
Now, one thing I figured out, and I always say I got ESPN because I watch ESPN, but I got ESPN is, listen to you talk and knowing your background, I'm sure one of the things that showed up in your profile is that you were a public servant.
Yeah.
And that you like to help people.
Yes.
So to me, the nonprofit sector would have been perfect, and that's the reason it probably showed up.
Yeah.
Right?
Yeah.
So what made you decide to take the jump, take the leap? Because everything had to ring out, but something had to call you.
Yeah. It did, and it is a calling. Kevin called it that the other day. Somebody was asking him if I was ever going to retire, and I overheard him say, no, this is a calling for Lori, which he had never said before, that I know of. So part of it was I felt like I could bring something to the table. Mm-hmm. Joe was amazing, but he didn't have that statewide view.
Okay.
And I'm a connector. So, for example, in this role, I'm on other boards still, right? And I want other people to care about New Directions. Right. And I want to partner people. I did not get off the board of HPI.
Okay.
And I meet with the CEO of HPI every month. And then I go to the program committee meetings and we share information with each other. Okay. I'm the vice chair of the Center for Nonprofit Excellence. I was the chair of the Kentucky nonprofit, which is a statewide kind of chamber of commerce for nonprofits. I'm in the Rotary, and this year I'm the Rotary president, right? So yes, I'm trying to elevate people's understanding of what New Directions and organizations like New Directions do, right? It's not just New Directions. But we could have 20. We have 5 or 6 nonprofit housing developers, and they're all great. They all do different things. They're all great. Really. They're all run by good people. There's not a one that somebody wouldn't say they're doing really good work. You could have 20 or 30 more, and it would not be enough to do the work that we need to do. So this competitiveness for funds or hiding resources, nobody's really doing that because we all understand how important it is. It's very meaningful to me.
Hello, my name is Sierra Clark, and I'm the Chronic Disease Manager at Park Duval Community Health Center. Ever since I started at Park Duval over 9 years ago, I have been committed to helping patients live healthier lifestyles. I am currently serving patients in the Chronic Care Management Program, or CCM program. My team and I help patients manage their chronic conditions such as obesity, high blood pressure, high cholesterol, and diabetes. In this CCM program, you will receive several benefits to help you manage your health. We offer monthly telephone calls to check in with your progress and to assist you with any concerns, assistance with scheduling your healthcare appointments, and assistance with filling your prescriptions in a timely and convenient manner. We also offer many resources to help you with the barriers you may face with eating healthy, being physically active, or monitoring your conditions at home. For more information, visit us online at pdchc.org or visit one of our health centers.
On rehabbing places, what's your rotation, like every 5 years or every 10 years?
It wouldn't be every 5 years. We're doing about 60% of our portfolio completely right now. I would say Joe probably did about 10% of it before he left, 15% of it, and the rest of it doesn't need it right now. So really it just depends on the property, but you have to keep up on it, and that's why asset management is so important.
It's key. But that's why I wonder, because looking at Doskin Manor, somehow they didn't have a schedule. Right. Somehow, because, and I've seen it happen over time, because it might be Section 8 or low income housing, people don't do the investment because they think that that's the standard of what it should be. And that's the thing that sticks out to me. Like I remember I had slum landowners. You didn't necessarily have to have air in certain places when I was in Florida, or we had no laws to deal with mold and mildew.
So how would that work on a day like today?
Right. So, and then when I was in Massachusetts, in Brookline, they didn't have HVAC systems, so it was air conditioning units. So I had to always put out, and it was strange for me coming from Florida. I'm in Brookline, I had to put out heat advisory because they were used to the temperature being over 85. So anytime it was over 85, I had to establish shelters.
So it's a different day. It really is. The habitability is different now than maybe it was however many years ago when these buildings were built.
Yeah, and that's the thing. So one of the areas that I have a lot of concern with, and I'm pretty sure it has approached you, is homelessness. Because one of the things, in order to begin to help a person, and from social work background, you have to provide housing. So have you looked at broaching that area?
Yes. So there's a certain percentage of people that are in our housing at any given time, at any time since our beginning, that were formerly homeless. We didn't really begin tracking that percentage until about 2 years ago. And one of the reasons is because we have a new board member, Stachel Bussey, and she was leading, of course she has the Hope Bus, but then she also was leading the effort to create the temporary housing for homeless people that Mayor Fisher put in place right before he left, and that is continuing now. And because of that, we were able to connect our staff directly with each other, and there has been more of a concerted effort to have people directly that are getting services from Stachel's organization into New Directions Housing. So that's a good thing. And that's a really good thing.
That is.
I don't know what the percentage is right off the top of my head, because for a while we were looking only at like 6-month increments, but it's a significant number of people.
Well,
that
I'm
we're helping.
assuming when you do that, you have to do all the wraparound services to keep them there.
Well, and so we don't provide that. I mean, that is not something that New Directions has done. We have wraparound services as far as we have after-school programs. We run St. Benedict's, which is an early childhood education center in the California neighborhood. We have senior programming, but we don't have specific specialized homelessness services. And so that's one reason I think we didn't really formally focus on it in the past. But because of the relationship we have with the person referring it to us, they continue to help that person through a certain period of time. I will tell you, the first time it hit me was our staff was scrambling trying to find furniture. They had gone over to somebody that we had just put into an apartment to sign some documents, like a name was left off or something, and because they had come to the office. And so the staff person went over to their new apartment, and there was not a stick of furniture in there. Well, we're not used to doing furniture. We are now, right? And there's people in the community that do that. So it's just a new relationship that formed.
Well, most of the times when you deal with housing somebody that's homeless, so you got to provide the wraparound service. Not necessarily you do, but you have to have somebody does, because you got to make sure, mental health is good, make sure they can buy groceries, have a stable job. It's just a lot of minutia. And that was kind of like, but I was in Florida, I saw the Homeless Coalition, and we got HUD money. And that money was used to bring homeless in and then provide the wraparound services. And we focused a lot on homeless, but also the veterans as well. And work with the different health departments and other partnerships. And I kind of
health
see
and housing are like this, right? I mean, they really are. A lot of people don't see that. And one thing I think is unfortunate is it's the same people. That's what I would say at finance. We're talking about the same taxpayer deals with transportation, workforce development, finance, and revenue, and yet we're all treating them like they're just your client. Nonprofits can't do that either. Right? You have the client, and that's the same client I have. But it's unfortunate a lot of times that the way the funding, even from the federal level, and the language associated with it is so specialized that even when we're dealing with the same issues, we don't often realize it because we use different language.
So looking at your background now, and what you have accomplished, what would you tell your younger self now that you have sat in the seat for a while? And then, what would be your advice? Because you do a lot of speeches and talk to people. What would be your advice to the younger generation?
I think that I have ended up where I am not by planning. So I think you have to have a base skill set. That's where being a lawyer and an English major comes in. And but for me, I had to be open to what other people were suggesting to find out what worked for me. So I would say talk to people, that somebody doesn't have to be your formal mentor. Just to call them and say, can I have coffee with you? And talk about where I am and the things I like to do, the inclinations that I have. And could you introduce me to one or two people that might be in my field or that I might want to talk to just for a different viewpoint? Because, it is trite. If you can't see it, you can't be it, right? But it's also true. I didn't know anything about being a lawyer, right? I didn't know anything about running a nonprofit. When people suggest things to you and you try them and they work, then they lead to something else. Everything that I have done has led to something else naturally. But I had to have that base first. So, get yourself a base level of skills and education, and then the experience, I think, will come.
Well, you had a base. Your base was led by faith and God
and family.
And you were able to be vulnerable at times. But the interesting thing that you didn't say is that somebody on the outside saw something in you that you didn't see. And usually that's what happens. Somebody sees something, and then you happen to groom into that. So now that somebody has bestowed that gift to you several times, How do you mentor younger people now that you see that?
Right. So I have 4 adult children
Mm-hmm.
and 2 grandsons. So there's lots of conversations around that.
Mm-hmm.
In my work world, I'm most in discussions with people who are in the middle of their career.
Okay.
And it's only when, like, the University of Kentucky or the honors program will ask me to come back and talk about my career
Right.
that I'm really dealing with people who are what you would consider to be young. And I don't know if this is appropriate or not, but I've told some people I'm not sure I would start out in the nonprofit sector
Right.
because of salary.
Correct.
Right? And
right.
so I'm not sure I wouldn't try to cut my teeth
Right.
in the business world or in the government world.
Right.
And then go work for a nonprofit.
Right. You know, one of the things I can see, and I've seen it over and over again, because I sit on nonprofit boards, but I came from a government background, and then, now I work in a nonprofit. We have so many rules in government that it's restrictive, because we want to make sure we're doing due diligence with taxpayer money, that
Right.
we actually have more rules in place than nonprofit.
I know.
And so you find yourself straightened up nonprofit. You're like, man, you did this?
Yeah.
You did this?
I agree.
But tell us, after following a legend that was in a job for 30 years, that's
Right.
a hard transition.
Believe me.
Right?
Right.
And then somebody always tell you, well, this is how we used to do
Sure.
it. How did you overcome that?
Sure. Well, first of all, it's great people that worked for him,
Right.
right? So they were open-minded.
Okay.
But they didn't know, right? If they
Right.
never worked for anyone other than Joe, I mean, there was
Right.
nobody that
Right.
was there longer than Joe,
Right.
right? So, but they were gracious, and they would say, well, that's not really kind of how we do it.
Right, 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 right. We always have
I was
done
like,
it this way.
Right. I was like, can we try this?
Right.
I also took my time because I had never run a nonprofit. I didn't come in with like 100 days of this is what I'm going to do.
Right.
I got to know people one-on-one. We used to be over in the old Casa Grisani restaurant,
Right.
which is the last property on Liberty as you're leaving going toward the Highlands. And that was gifted to us by the Grisani family, which was wonderful 20 or 30 years ago. We used it as our headquarters until we moved to where we are right now in West Louisville. But I would take all the people that were middle management or up and just walk 45 minutes with each one of them.
Okay.
Tell me about yourself. Tell me what you wish for us. Tell me what you wish was different. Tell me what you wish that we're doing that we're not doing, or
Right.
the opposite of that. And that really helped me understand the organization and the assets that we already had. And then I was lucky enough that I had worked in other organizations in a role where I had the ability to create a team.
Mm-hmm.
And, I feel very lucky in a lot of ways for different experiences and education that I have. But the experience of putting together high functioning teams
Mm-hmm.
is something that I really enjoy. And I've been able to do it several times now, and I've done it at New Directions.
Hello, I'm Dr. Swannie Jett. Please make sure you visit one of our 5 locations, not only in Louisville, but outside of Louisville and surrounding areas. Thank you. Tune in to CEO Live Talks with Dr. Swannie Jett every Saturday at noon on Wave 3. In this thought-provoking series, we bring you conversations with influential leaders, visionaries, and changemakers who are making a difference in their communities and beyond. From healthcare innovation and public health initiatives to community building, each episode offers a unique perspective on the challenges and opportunities we face in today's dynamic landscape. Join us as we explore the stories and insights of these inspiring individuals and gain valuable knowledge that can drive positive change in your own life and community. Don't miss an episode. Mark your calendar for Saturdays at noon on Wave 3 to watch CEO Live Talks with Dr. Swannie Jett. Together, we can shape a brighter, healthier future for all. So what is the future for New Directions?
What's next?
What is the future? What's next?
Oh, the future. So I'm not looking to leave, New Directions right now. We are in the middle, of doing these rehabs. We just created a new program, first of its kind in Kentucky, to help people stabilize even better. It's called iRise, and move out of Section 8. Not only does that help that family and the neighborhood, but it also opens up a unit for somebody else that needs it, right? So using infrastructure in a way that people hadn't really thought about before is very exciting. We took Repair Fair, which has been around for 31 years, and it helps seniors stay in their own homes, not our homes, homes that they own themselves, but they don't have the money to rehab them now. We've taken that from a program that the rest of New Directions subsidized, and now it's spent $3.9 million in the last year that we've been able to attract those resources. We've taken something now experience, again, the value of hiring good people. St. Benedict's Early Childhood Education Center, which had been a jewel in the California neighborhood, and went all the way down almost to bankruptcy. 2016, New Directions took it over, got down to 30-some kids. We have 100 of them now. It's a Head Start facility.
That's great.
And we've gone from a 3 rating for the state to the highest level 5. So just had 15 preschoolers, 15 5-year-olds graduate, and they're kindergarten ready. So anyway, all of that is very exciting. So there's a lot going on still. We had a capital campaign, first one ever that was a formal capital campaign. Kim Hallbauer of Fifth Third was our chair of that. We were like, well, let's try to raise $2 million. We've never done this before.
Right.
Kim said, let's do 3. We ended up raising 4.
Wow.
And that's from the local people. In addition, during that same time frame, people usually count this, right, as their capital campaign, but I distinguish between the local. We've gotten $1.2 million from HUD to help keep seniors in their places more safely. This year, $6.36 million for what's called the GRIP program, which is a way to more environmentally rehab. That's for a portfolio that we call Directions. I don't have to worry now about going to Kentucky Housing Corporation to compete for low-income housing tax credits, because I've got that HUD money for that 106 units of Directions. Now I can focus on another part of our portfolio.
Right.
So there's a lot of going on right now, which is very exciting to me. I wouldn't say that this is it for me, though. I mean, I really am open to doing something different. I just don't have it plotted out.
Right. Well, I wish you all the success. And one key thing that people don't realize, when you sit in the seat as a CEO of a nonprofit, you got to fundraise.
Right?
It doesn't stop.
It doesn't. You have to fundraise. And of course, as we know, it's harder, right? Every year that goes by, it seems like it's harder to do. But we support each other.
Right. Well, thank you for coming to the show.
Thank you for inviting me. I really appreciate it.
And this concludes the show for today. Hopefully you've enjoyed our delightful conversation. I do want to thank our listeners. You see this beautiful Telly Award for CEO Live Talks, and it was through your support and watching the reason that, me and myself, Fred, my executive producer, did a lot of the taping and editing, and but it was also you, the watcher, listener, and the excellent people that we have interviewed. So thank you.